Hernias are a common health concern that can occur in both men and women at any age. Dr. Abhishek Gupta from Bronson General Surgery Specialists in Battle Creek is here to shed some light on that, give us some information about hernias and how they are surgically repaired. Dr. Gupta, good morning to you.
Hey, good morning, Tim.
You know, it's funny. I'm told I had a double hernia when I was an infant, and to this day, I still have no idea what that really is. What is a hernia and how does it occur?
Well, it's a good question. It's a common problem, and sometimes, like you mentioned, sometimes people are born with hernias, and they often get fixed when they're babies, when they're infants. Other times, they can develop over time for different reasons. It's a tear or an abnormal opening that develops in your belly or groin area, and sometimes there's a natural area of weakness, and sometimes you get a tear in those layers, and that allows the things from the inside, like your organs, to push through this abnormal opening to the outside. And so the bulge that's there, it can be small, sometimes they're bigger, but it just depends on how big of an opening there is.
And from what I hear you saying, I gather then there are different types of hernias. Can you share with our audience those different types of hernia?
Yeah, sure, Tim. The one of the most common types is the groin hernia, which is called an inguinal hernia. And what happens there is sometimes some fat or intestine or your bladder from the inside pushes through from the inside through this tear or opening and bulges out to the outside. And then sometimes it's more common to have hernias here, but women can have them here too. You can get hernias in your belly button. It's called an umbilical hernia. Sometimes you notice a little knot or a bulge there. And the same way, you get a tear there, and sometimes fat or intestine can pass through there right around your belly button. Sometimes people have had surgery before, and where they have their old scars, you can get a hernia through the old, that old scar tissue just below that incision from when people had previous surgery. They can happen anywhere else in your belly as well for different reasons. And then the other kind you can have is higher up. It's called a hiatal hernia, where you have a slightly larger than normal opening that lets part of your stomach pull up into your chest. And, they can be small or large, but they can cause symptoms as well.
Now, you alluded to this, but what are the symptoms of hernia that someone might have?
Yep, they can really vary. Sometimes hernias are really small and people may not know they're there. Sometimes they're big and still people may not realize it's there, but it can be something just a bulge that you notice or a hard lump. Sometimes it looks different from the right side to the left side if you're looking at the groin. Sometimes it can just be an area that looks a little swollen. You can have pain at the site, but sometimes it hurts worse if you're coughing or sneezing or trying to lift something up or straining.
Now, I think I know the answer to this, but do hernias heal on their own?
Unfortunately, they do not go away on their own. They'll either stay the same size or they may gradually get bigger over time. So they're typically easier to fix when they're smaller, so we try to get to them sooner if we can.
Dr. Gupta, I used to hear people say this a lot, don't lift that heavy thing, you'll get a hernia. Is that a thing? Can that really happen?
Yeah, and I'll kind of try to explain why, and it makes sense. If you think of your chest as one space with your heart and your lungs in there, then your abdomen or your belly is a separate kind of space with your stomach, intestines, and other organs. And when people strain or bear down to lift and they hold their breath, well, that's increasing the pressure in that space, and it's making things from the inside want to push through to the outside. You can tear something easily doing that. So that's why when you want to lift something heavy or exert yourself, you want to exhale, you breathe out, it decreases that pressure in here. So sometimes when people are coughing or sneezing, sometimes that happens and it makes it worse and they can get a hernia just by doing that. And so that's why, people might mention don't hold your breath when you're lifting something heavy. You just let it out and it decreases that pressure in there. So you're right.
Good advice. How common is hernia surgery, and are all hernia surgeries the same?
That's also a good question. Hernias are a really common problem, and they can fix them a lot of different ways. In this country, there's over 1 million hernia surgeries a year, and there's a few different approaches, and it's different for everybody and what's may be appropriate for everybody. The one kind is the traditional or open surgery, where you just make an incision, usually over where the hernia is or where the bulge is, and you work through the layers from the outside, and you get to the things that are bulging through. Separate it out, you push it back inside where it belongs, and you repair the hernia, a few different ways. Another approach is the laparoscopic approach, where you might make a few smaller incisions away from where the hernia is actually, and you're working from the inside. You're working inside the abdomen or the belly, and you can see the hernia from the inside, and you do the repair from the inside using instruments. Another type that I do a lot of is the robotic surgery, which is a type of laparoscopic procedure, but it's a little bit more advanced. The camera is better. The instruments are a little more advanced and can do more things. And we're looking at things from the inside, and usually we're able to pull everything out that's bulging through the hernia. And when we can see the hernia itself, then usually we try to close it or sew it shut. And then oftentimes we'll lay a mesh in there to reinforce that repair, to make it stronger and reduce that risk of that hernia coming back or causing more problems. But doing it this way, people tend to have less pain. They're usually in the hospital for less time if they have to be in the hospital at all. For example, doing groin hernia surgery with the robotic approach compared to just the open approach, usually we can get people back to full activity a full 2 to 4 weeks sooner. So to me, that's significant. And even though it's a little more work sometimes for me that way, if my patients can get back to work a month sooner, well, I think it's worth it in those kinds of situations. So,
well, doctor, what should someone do if they suspect they might have a hernia?
You should contact your doctor and see if they can take a look at it for you. If there's any questions, though, they can always send you to our office, which is the general surgery office in Battle Creek with Bronson. If you have any questions for us specifically, they're more than welcome to call our office, and I'm happy to answer any questions that I can.
Dr. Abhishek Gupta, Bronson General Surgery Specialist of Battle Creek. It's been fascinating. Thanks so much for the info.
Hey, thanks for your time, Tim. Appreciate it.